Hey you guys, I'm here today at the end of the day, and this is a really interesting case. She came to us, and she can describe it better than I can, but I'm just going to give you the gist of it. She came to us from England. She had had an interesting experience there, but when she came to us, she was really apprehensive of not just receiving treatments from us, but not getting any worse. And this is something that was affecting her life, it was affecting her job, her career. So we've had her now for 7 weeks, and her face has gotten significantly better, but we had to pull off the guns on this one. Like, we really had to get creative. So go ahead and tell your story a little bit, because I think it's a lot better when you tell it. And I'm going to continue doing my laser genesis, which I will tell you about in a minute, but go ahead.
It's been long. Since 21 I got adult acne, and as a makeup artist it's kind of stopped me from working. So I've been trying to do everything and anything that I could find. It was chemical peels, I did microneedling, Accutane with steroids, and that went horribly wrong. And I just ran out of ideas and I didn't know what else to do. So I was at the point where my skin was completely compromised and I just gave up and I didn't think I could do my career anymore. And then I came to you guys. Can you help me?
Yeah. So we've had her for 7 weeks, and when she first came, she had some pretty severe cystic acne. I mean, to the point that, like, even if you touched her skin, it was painful, right? I mean,
Yeah.
The inflammation was so bad. And the first time I met her, she was like, "Okay, listen, like, don't hurt me, don't anything." And you know, it's really been taking the last 7 weeks of us building a relationship. Now she comes in and she's like, "Oh, you're gonna do the genesis," and like, it's no big deal.
I love it.
But I've had to earn that trust with her, and so what we started with today was a silk peel. And we do a silk peel because it takes all of the oils off the top of the skin. It helps to clog all the pores. So now we're going to be able to penetrate deeper with our devices. And the first device that we started with is the laser genesis. Now, she has redness, but to me it's a diffuse redness, like a generalized erythema. She doesn't have those specific veins that you maybe get on the corner of your nose. So for this one, we chose the 1064 wavelength, and it doesn't really hurt. It kind of feels like warm water is being poured on your face, but what it does do is decreases underlying inflammation. It helps the current acne, kind of takes away that, the pustules, kind of calms everything down, shuts down that generalized erythema, that generalized pinkness. And right now we've been treating her, so you can see that, you know, she does have a little bit of redness, but comparison, and we will be showing her before and after shortly, but in comparison, this is really good. When she came in today, she's like, "Reve, I feel my normal skin, like I feel my skin," which, you know, I think some of us take for granted, especially those that haven't gone through something like this. And she got treatment in England, she got treatment here, so she kind of came to us as a last resort, and she's really been getting better every time. What do you think about the genesis? It's not too bad, right?
It doesn't hurt. Now that I've had it a few times, I can just tolerate it completely. It just feels warm.
The first time she had it, she was in so much pain. She had so much inflammation on her face that the moment I ran over the laser with it, I mean, she was having a hard time. So we had to lower the energy. Now we're at the highest energy. And what you guys can see, oh, well, let's see if you can kind of look at this. It gives me a real-time feedback of where her skin temperature is at. So I know when I'm treating safely, I know that I'm not going to burn her. Heat is accumulative, so I know I got to keep my laser moving pretty fast. And depending on what we're doing, I can place more energy into one area than another. But in general, we'll do about 5,000 to 6,000 pulses for the face. Okay. So, on to our third. So for those that are just tuning in, I don't have to yell. So for those that are just tuning in, we are doing a combination treatment for somebody who had adult acne, and pretty severe adult acne. She had really bad cystic, along with comedonal acne, and she'd been having this for, well, you said like 10 years, right?
It's I'm coming up to nearly 9 years, but I've always had issues, but it's to the point where I don't even recognize my face. I don't know what it was. So
Yeah.
it's just been like this forever.
So we started with the silk peel. The The silk peel is going to help take off all the oil, all the impurities in the skin, declog the pores, and allow for deeper penetration of the devices. So we use the 1064 laser genesis at first, and that's just going to decrease the inflammation, the underlying inflammation, decrease the generalized redness that the skin has, and any current breakouts, it will reduce those also. The second one we're going to do, or third one we're going to do today, is called the Clear and Brilliant. Now, for those that are in the industry, there's two separate hand pieces for this device. The Clear and Brilliant, also called the Original, is used for different things, lighter skin types, scar remodeling. When we use the Permea, which is the other hand piece, we can use that against the darkest of dark people. We can use it against people that have severe melasma, and we don't have to worry about that rebound post-inflammatory hyperpigment. But today, because she's similar to my skin tone, although I think I'm whiter and pinker, but she's really fair. And so what we're wanting is more of a turnover and remodel of the scarring. So we're gonna go ahead, and I like to be extra nice and give my patients fans because it helps the laser work better. Yeah, this is the Clear and Brilliant. Now you wouldn't want to use the Clear and Brilliant on darker skin types or anybody with melasma. That would be the Permea handpiece. Oh, here we go. You can kind of hear the device. It's really hard to see the channels, but it's fractionated, which means we're only treating a fraction of the skin. We're leaving healthy tissue in between the skin, so it's going to cause for a faster turnover. Not to mention, there's very little downtime with this one. So for the first 3 days, your skin starts to feel like sandpaper. And from day 3 to about 5 to 7, your skin is sloughing off. When I say sloughing off, it's like using a little bit too much Retin-A. You know, your skin's kind of peely, but not too bad. You can still wear makeup, go to work. It doesn't affect anything. And then by day 7, your skin is completely off and you have this new baby fresh skin that hasn't seen the sun before. And it's absolutely gorgeous. This treatment can be repeated every 2 to 4 weeks, depending on what we're trying to achieve. At Dr. Emer's office, it is our #1 maintenance. So I do a lot of Clear and Brilliance. That's what that means, a lot of Clear and Brilliance. Or Permeas. But we combine this one. We can combine it, I just did the Genesis. We can also combine it with microneedling and PRP. Today, we are going to highlight one of our newest devices. I'm obsessed with it. I'm obsessed. It's called the Fractora from InMode. Now, this is not just going to tighten the skin. So it is radio frequency. It is done by microneedles, but it has two different, well, I'll get to that later, but it has 2 different ways of doing it. So we can treat darker skin types and lighter skin types. So I will be highlighting that particular device next. And then we're also going to do microneedling and PRP. So she's getting the complete overhaul today. A lot of doctors are like, wait, you just did all of that in one sitting? But how amazing are our results? In 7 weeks, we have like, it's been incredible.
Yeah.
She could tell you, but I get to see her every week. And so when you look at yourself every day, but every time she walks in the door, everybody's like, what? So excited. Do we have any questions for those that are tuning in?
No questions over here.
Okay.
Just a couple comments. Some people said they got it and they had amazing results.
Which device? The Clear and Brilliant?
I think she was referring to Genesis.
Okay, Genesis. Yeah, Genesis, there's 2 separate wavelengths to that one. And so there's a 532, and that really targets a lot of those specific vessels that I'm talking about. So the ones around the nose, I have a whole bunch on my chin. You know, that's where you're going to use that 532. It's going to target the hemoglobin inside of those vessels. It's going to shut them down. The side effect of that would be if you're red, you get puffy. It's such an effective laser. I'm obsessed with it. I've been using it for so long. But for those that, you know, if it's a first time treatment, I always say expect to be puffy because if you're red, you definitely absorb more of that energy.
And then what are all of the procedures that she had in the past?
So what have you had done? I know we've done quite a few.
It's basically these. I've had silk peels, like we were saying before, to crack. Then laser genesis, but we've built up to it. Clear and brilliant, I get 1 on, 1 off for every week I come. And
So
then
we're
I get
doing
tried
her
that.
treatments every 2 weeks. So Genesis is every week. Clear and Brilliant every 2 weeks, every other week. And today, this is the Fractora will be her first time doing it. You know, it's completely normal to feel anxious before you have a treatment that you've never done. We have people come in all the time, and they're like, we're so anxious about it. And I always tell my patients that anxiety is always worse than the actual treatment because we get ourselves so worked up, but the reality is it's not that bad. I've never had a patient get off my table and say they can't handle something, and she wouldn't be my first. So we always get our patients through the treatments, whether it takes a couple extra minutes, couple extra ice packs, whatever it is. We're all about comfort here at Dr. Emer, so we do whatever we can to provide that comfort so our patients continue treatments and don't have bad experiences.
And then Michael wants to know if she's done a salt facial yet.
Have you done a salt facial?
No, but I've had a Rev Fresh. That worked amazingly.
Mm-hmm.
I really love that.
So, Candace, our amazing esthetician here, kind of caters what we're trying to achieve to each patient. And so with our Rev peels, we have 3 different ones. We have the Rev Fresh, we have the regular Rev, and then we have the Rev Black. And depending on what we're trying to achieve, she can really kind of make that specific for your skin tone, your skin type, and make sure that we're trying to get the most out of one treatment.
And then someone wants to know about the painkillers and anesthesia. I believe it's a topical numbing cream.
So Dr. Emer gets his topical numbing cream compounded. I've been in the industry for about 10 years, and I can tell you it's the best numbing cream ever. Almost to the point that I don't like to use it because it makes my whole face feel numb. And then it always gets in your mouth, and then your mouth feels numb, then your tongue feels numb. But it's so effective. So for people that are getting those treatments, that's all she's had. She has had no other pain medication. She had topical numbing. And even with the Fractora that we're going to do next, she's not going to do anything else besides topical numbing. So how do you feel?
It's completely tolerant. This one's a bit more pinchier, I find. It's like, it feels more like a scratch rather than heat.
It is scratchy. That's a really good way to describe it. But it's not painful. It's just kind of annoying.
It's like someone's just slowly dragging their nail constantly, but it's like, it's not painful, it's just like happening over and over. No, even for my skin, I find that I'm hypersensitive to everything at the moment, and this is fine.
She was even like, we offered her pain meds today, and she was like, no. No, absolutely not. She's just had some bad experiences before, and so that's enough to leave anybody feeling a little apprehensive. And so we're almost done with the Clear and Brilliant, and I'm going to highlight the Fractora for a second for those that are still tuned in. Go ahead and bite your top lip for me. This is a sensitive area. This is where that fan really helps. You can shine it. Helps me too because I'm like, it's hot in here. Do you have any questions? Any thoughts?
Lots of hearts.
Oh, we love hearts. This is like where I completely love my job too. I mean, I think people think of, oh, you're in the cosmetic industry, you're making people, feel good, but it's a lot of Botox and fillers. That's what they think. But we've had a lot of patients that literally it's life changing. She's able to go back to work. She was just telling us a story how what was it? It's like you got into your...
Which what?
The recent job that you got, or like you said you've been waiting 5 years for it.
Oh yeah, I never even when I trained 5 years ago in makeup, I never dared go to a counter and ask for a job, because you can cover this with makeup, but when it's textured and risen, you can't. It doesn't matter what you do, you need to deal with skin prep underneath, and so I never went there. And then the other day, because my skin's so smooth now and it's just, you know, a little bit of redness left, I applied and they wanted to hear back from me. So that's the first time I walked into a counter job and asked for a job.
That's amazing. That's so amazing.
There's a couple people just tuning in wanting to know what the laser is.
What are we doing? Okay, so for those that are just tuning in, we're doing a combination treatment to treat acne scarring and also a little bit of residual acne that's been happening. So she couldn't go on Accutane, but we knew that we had to get the cystic acne under control. So she's been with us for about 7 weeks. We've done peels, we've done laser genesis. What else have we done?
Refresh. We've done silk peel, clear and brilliant,
and laser genesis.
Yeah.
So that's what we're doing today. We started with the silk peel. That's to decongest her pores, get all of that dirt and grime out of there so our lasers can penetrate deeper. Then we went to our XLV, or also the laser genesis, which is a 1064 wavelength, and it's going to help penetrate deeper, shutting down that red tone that our skin gets, the inflammation, also with the breakouts, shutting down any of the kind of the acne that's there. Then we went to our Clear and Brilliant. We used the original handpiece, not the Permea. I wanted a little more remodeling along the acne scars, and she's gonna get a great pore reduction. It's like, this is like the best thing for pore reduction. Okay, so hold on one second. I gotta switch my devices.
Can this be used on darker skin?
The Clear and Brilliant, no, but the Permea, yes. I just treated one of my patients. He's in the NFL. He is a dark type 6. And he told me last week that, he's like, what'd you do to my skin? My skin's feeling amazing. And I'm like, of course it is. But we did the Permea on him. That was the whole point to that. Okay, so this pretty little device. It's always a real estate issue trying to get all of our fun devices. So for those that know Dr. Emer, everything we do is combination treatment. This is how we get the treatments that we or the results that we get. Most offices would probably do one at a time. Say, see you back in 2 weeks, no problem. 6 months later, they're still fighting the same thing. We had 7 weeks, actually 8, so next week is her last week. We had 8 weeks to do whatever we could to get her back in a place where she can function professionally, personally, and okay. Okay, you guys, so let me just give you a quick rundown. This is radio frequency. It's also microneedle. So we have a couple devices here. We're lucky enough at our office to have multiple modalities that do the same things. We have 6 vascular lasers. This would be our vascular laser that I use today, but we also have 5 others. We have 2 different radio frequency microneedlings. And depending on what we're doing, we can really pick, you know, what we're trying to achieve. So this particular device, we're using a 24 pin, so it has 24 microneedles, and they're non-insulated. Why does that matter? So she's really fair. I want that energy to be dispersed across the entire surface of the skin. I'm not worried about bypassing her epidermis because I'm trying to remodel it. Lighter skin types tend to be dry, tend to be wrinkly, so we want to remodel that whole area. Now, if she was dark, we would want insulated needles because then we would be bypassing the epidermis, putting that energy at a specific depth, and not causing any post-inflammatory hyperpigment. So with her today, we're doing the 24 pin. We can also double pulse with this. And why that's important, because it's like if you pull one nasal hair versus the whole thing. You're not gonna feel it, but you're gonna get twice the energy. I got push start. I was just kidding, everybody. Hold on. I got push start. Sorry, that was not nice.
I can feel them.
Okay, 1, 2, 3.
And Reve, I have a question on the Clear and Brilliant. Do you ever use 2 different hand pieces on one treatment?
No, I'm decisive. I know what I'm trying to do. Now, I might do, I might switch it up. So for your next treatment in 2 weeks or 4 weeks, I might switch up hand pieces depending on what I'm trying to do. But most of the time when I'm using a Permea, it's for a specific purpose. If you have melasma, I'm never going to use the Clear and Brilliant, the original hand piece. If you're really, really dark over a type 4, I'm never going to touch you with the Clear and Brilliant. So normally, I mean, you just have to know your lasers, you have to know what they're doing and what their restrictions are. Okay, you guys, so I'm so glad I was able to talk to you about our brand new device called Fractora. I'm going to go ahead and finish her treatment today, but if you guys have any questions, you can call Dr. Emer's office. Thank you.